Thank you very much for this opportunity. I speak to you from Guardianship, Patient Advocacy and Residential Advocacy in Austria. Austria's healthcare system offers high-quality services for patients and respects the patient's rights of self-determination in many ways. Competent patients have the right to make their own medical decisions. Patients must consent to all forms of medical treatment before it can be applied. Patients must be informed of their rights and are entitled to an explanation and information on possible forms of treatment as well as on the risks involved. Information should be given in a clear and considerate manner. Patients have the right of access to medical files. Unlawfully depriving a person of his or her freedom or restricting his or her freedom in any way constitutes a crime. People who need help to make medical decisions because they suffer from dementia very often have their legal capacity restricted by order of a court. In Austria, appointing a guardian and restricting the legal capacity of the ward are two sides of the same coin. In strictly personal matters, there are two exemptions from this paradigm. If the ward is still able to make sound judgments for himself or herself, we call this Einsichts- und Urteilsfähigkeit, only he or she decides about his or her medical treatment and choose the place of living by himself or herself. If the person is incapable of consenting, consent has to be given by his or her legal representative. According to paragraph 283 of the General Civil Law, the guardian must seek authorization by the court if the medical treatment has serious or lasting effects. The guardian can also give consent if he has obtained an independent expert advice, as long as the ward does not resist the treatment. If the ward does resist, the court has to be involved. These rules of oversight are very important. In this process of substitute decision-making, the guardian has to involve the ward and take the wishes of the ward into a consideration and even act according to those wishes if this is possible. According to paragraph 282 of General Civil Law, the guardian, nevertheless, is responsible for ensuring the medical and social care of the ward, even if consent to medical treatment is not included in the guardian's duties. Only due recent legislation, the traditional role of the guardian has successfully been modified. As long as the ward is still able to make decisions for him or herself, in these personal matters, the guardian cannot decide instead of or on behalf of the ward. The ward's natural will has legal relevance. In my opinion, if carried out with diligence, these principles are very close to supported decision-making. Another very important aspect to the role of Austrian guardians concerning restriction of movement. The public law regime for limitations of personal freedom does not involve the guardian, whereas in most European countries the guardian decides about the use of force. However, persons who are suffering from a mental illness can be involuntarily interned in a psychiatric hospital or psychiatric department if they represent a serious and considerable risk to their life or health or that of other persons. A doctor in public health service or a police doctor has to certify that these conditions for internment have been met. In this case, special patient advocates have been granted the power of representation. A court decides whether the internment measures have been met or not. The patient advocate must inform the patient of intended actions to be taken on his or her behalf and any other important matters of measure. The patient advocate should comply with the person's wishes if this would not be detrimental to his or her well-being. The patient's representation does not include legal incapacitation. The patient can act independently before the court. If the freedom of movement is restricted to one room, or if the patient is confined to a safety bed, to a straitjacket, or fastened or tied to a chair or bed, these measures must be specially ordered by the treating doctor, and the patient's advocate has to be notified immediately. The advocate is entitled to take legal action to review all restrictive measures. A court review is held. The court hears at least one psychiatrist who is not affiliated with the hospital. The patient, his advocate, the head of the psychiatric department are to be interviewed by the court. The court decides whether internment or restricting measures are admissible or not. In nursing homes and similar institutions, all measures restricting the patient's free movement have to be brought to attention to the residential advocate. The advocate visits the patient, talks to him and to the staff, and checks the requirements. The terms and conditions for restriction are the same as those for internment in a psychiatric department. The residential advocate can call in the court to review whether the measures taken are appropriate. Residential advocates hold close cooperation with the staff of residential homes. The courts have set new standards, which are in interpretations of the law itself or amendments to existing standards. The new or revisited standards have an impact on the day-to-day routine in hospitals and nursing homes. For example, to prevent patients from falling out of bed, many residents have been tightened. It is now clear that bed safety rails must not be used when the resident is liable to climb over the top to get out. In these cases, low-entry nursing care beds used in conjunction with the crash mat or safety mat have therefore become a standard for all institutions. We can only reasonably confident guesses about the progress which has been made in Austria's healthcare system. In guardianship, our role as decision maker is to support our wards and to ensure that as far as possible the wishes of the wards are taken into account. There is greater awareness of coercion in extremely serious problem which affects the whole society. In taking care of patients, there is preference for non-coercive ways. A balance between ensuring autonomy and protection is not easy to achieve. The federal law of organized guardianship, patient advocates, and residential advocacy is designed to provide the means to protect these rights and the dignity of people who are involuntarily interned or are incapable of consenting to medical treatment. In these difficult situations, most of us have no idea how vulnerable we really are. Thank you for your attention.